Hi, this is Skylar Robinson, and this is my needs assessment presentation. The purpose of my needs assessment presentation was to gain knowledge on the resources and services available to military veterans and their families to help them better adjust to the transition and readjustment from military to civilian life. I decided to focus on the mental health side of the transition. Therefore, the issue that I was looking into was the need to expand services and evidence-based practices provided by the Veterans Health Administration to other behavioral health centers in Tucson. This will help to provide a wide range of resources in various communities to better cater to veterans and their families. In the military, servicemen and women developed a strict mindset that requires focus, discipline, perseverance, and resiliency. This mindset is used to help them to overcome traumatic and dangerous experiences that they are constantly exposed to in this field. With these experiences, veterans tend to have presenting problems of suicidal ideation, PTSD, substance abuse, depression, and general anxiety disorder. This is seen especially in Operation Iraqi Freedom and Operation Enduring Freedom veterans. The number of mental health diagnoses for veterans has more than doubled over the past 15 years. These problems can contribute to difficulties attaining a job, keeping a job, unemployment, and can lead to an increase in homelessness. I read from a journal article that veterans have to adjust to drastically different environments, daily schedules, and set of relationships, which can lead to a great amount of stress on the veteran and their family. The family also deals with the stress of losing who the veteran was before their deployments and services to who they are now. One of the biggest organizations that has already tread the path to helping this population is the Veterans Health Administration, or Veterans Affairs. The VHA has continued to be responsible for meeting the mental health needs of veterans and their families. Some of the common therapies and services that I have read in the literature that have been proven to be effective for military-related post-traumatic disorder and anxiety are cognitive behavioral therapy and trauma-focused therapy. There are also various transitional services that are provided by the VA that include gaining employment and housing. For my data collection, here are some of the questions that I used for my interview to understand the strengths and challenges of veterans and their families, the kinds of services that have been proven to be effective, and the services that my interviewees could potentially incorporate to the agency that they don't already have. I was able to talk to an intake therapist from Casa de los Niños who has been there for about 4 years and is working on getting her license in social work. She explained that the nonprofit agency really has a welcoming environment for clients, and the teamwork and support that the employees provide for each other really work to create a positive environment. I was also able to interview the grants and per diem liaison from Veterans Affairs, or the VA, who has been there for about 7 years. She is a licensed clinical social worker who oversees programs and campuses to help homeless veterans. She explained that she loves her ability to diversify at the VA and how social workers are very valued there. She has been able to be a part of various programs with the agency throughout her years and went from direct services to overseeing different programs as a supervisor. Some of the common answers that I got from both individuals was that the common presenting problems that veterans and their families experience are PTSD, substance abuse, and depression and anxiety. Each organization provides services for employment skills training and services to help with the adjustment to domestic civilian life. The strengths that they both witnessed in military families and veterans are their resiliency, the endless support community that they provide for each other, their resourcefulness, and their adaptability skills. Now, from their different perspectives, the intake therapist from CASA pointed out that the therapies they provide that are useful for veterans and their families are cognitive behavioral therapy, eye movement desensitization and reprocessing therapy, parenting training courses, and solution-focused practices. She pointed out that the military population are not common clients that come into CASA. If they do receive CASA services, their presenting problems aren't necessarily different from the general population that come to CASA. Some of the limitations that the therapist pointed out was their curriculum for therapy and services is not specified for veterans and their families. There can be a lack of cultural understanding when working with these clients, and there are no trainings that cater to the specific population available to them. Another huge factor is that the only insurance that they accept at CASA are Access, Medicaid, and Medicare. Now, the liaison from the VA pointed out that the mental health services are always provided to anyone who has served in the military. Veterans have the ability to walk in and immediately receive services depending on the severity of their need, and they can receive services with filling out the paperwork after they receive them, which can be very beneficial. They provide very specific medical services and mental health services. They provide case management services, independent living, housing, case management, transitional services, and many therapeutic services. They also provide different programs specifically for veterans who suffer from substance abuse, PTSD, and serious mental illness. Some of the limitations identified by the liaison are that they don't provide more family-oriented services, and they also only help veterans who are willing to reach out and accept help. She explained that not a lot of veterans are able to reach out for help, and that they would prefer to go to other behavioral health centers such as COPE or Kodak in Tucson because they want to get away from the military environment, which can be helpful and sometimes stressful given that many behavioral health centers don't understand the military lifestyle, experience, and language. She pointed out that this can be very stressful on veterans, but it is not something that service providers can't learn. So based on everything that I learned from the literature review to the interviews, my recommendations would be to expand the training on military-focused curriculum to outside behavioral health centers. The liaison explained that they are involved in many on-site trainings for their job position, but does not know of any public trainings for other service providers. I think this would be helpful in community resources expanding their knowledge to be more effective for a wider population. I would also try to incorporate more support groups and family-oriented programs that don't necessarily have to be based on a therapeutic curriculum to introduce military families to individuals who have also been through a similar path and can provide more resources and create natural supports for military families. I would also recommend slowly introducing resources and practicing evidence-based therapies that are catered for the military population in various behavioral health centers to provide veterans and their families with more locations to go to and address their immediate mental health needs. To spread the news, I would like to reach out to trainers that teach the military-focused therapy curriculum to see if they would be available to teaching the public or providing trainings to different behavioral health centers to help them learn interventions that will be effective for the wider population. I would also like to further research the benefits of spreading out the services to community centers to provide veterans and their families with multiple resources that they can turn to. I would like to follow up with the connections that I have already made through the VA in Casa de los Niños, and maybe try to reach out to other behavioral health centers to see what they provide and how expanding their services could be useful in helping more of the population. I could incorporate the ideas from employees within these organizations to create plans for next steps and action for this need. I overall really enjoyed this project. It was really beneficial for me to be able to use personal connections to find people to interview. It turns out that my first interviewee from CASA really helped me in finding my interviewee from the VA, which was very stressful. From their insight and ideas, I was able to learn so much more than I knew before doing this project. Working with the military population is a passion of mine, given that I have experience being a military dependent. So getting to know the liaison from the VA was very beneficial for me. They made me realize that I didn't know a lot about receiving mental health services and the services that are provided during transition from military to civilian life. Overall, this project really helped me to open my eyes on what I can be doing for this community. So some of the challenges that came from this project was it was kind of difficult for time management and planning. Ideally, I would have followed through with my work plan and have been more efficient with reaching out and completing my interviews. The research aspect of this project was a little difficult for me as well, and it was harder to narrow in on a topic that really associated with my passion and future in the behavioral health career field. If I can make any recommendations to anyone doing this project in the future, it would be to stay open-minded and accepting of the changes that come along and help in narrowing down your topic. Thank you.